I think it's helpful for parents to know that eating disorders are serious medical illnesses. They aren't a choice. No teenager is choosing to have an eating disorder, and it's certainly not a lifestyle choice or just teenage rebellion. It's a serious illness, just like cancer or diabetes or asthma. I think it's very important for parents to understand this for a couple of reasons. Firstly, if they really understand that this is an illness, they're more likely to take it seriously and to get treatment as fast as possible. Research shows that the sooner a person gets treatment for an eating disorder, the better the outcome or the prognosis. So that's a very important point for parents to realize. A couple other reasons why it's important not to think of this as a choice or a lifestyle. One is when people view an eating disorder like a choice, they're more likely to convey blame and criticism. And research shows that the more judgmental or critical parents are of their children, the more difficult it is for them to recover from an eating disorder. It's also very important for parents not to blame themselves, because the more a parent blames themselves, that just makes the child feel more guilty about the burden that they're causing and the trouble that they're causing their parents by having this disorder. And so this type of guilt that the child feels can just feed the eating disorder thoughts. So I think it's very important that parents realize that this is a serious medical illness and we don't actually know the cause of eating disorders. Oftentimes parents think to themselves, well, if we could just figure out the cause, we can solve this. And unfortunately, recovery just doesn't work that way. Even if you think that you've found the cause of the eating disorder, there's really no way to prove it. So really the way we focus on recovery here at Children's Hospital is by not focusing or trying to find some underlying cause, but really focusing on how do we support this child or adolescent to recover from the eating disorder, and what are the obstacles that are getting in the way of recovery, and to try to remove those obstacles.